Okay, so good evening, everyone. My name is Melanie Cunha, and I am one of the managers at the Halton Resource Connection. THRC is pleased to welcome Dr. Lobo to our virtual interview, Associate Medical Officer of Health in Halton Region. Dr. Lobo is currently the medical lead of COVID response at Halton Region, and I want to thank her for joining us today, especially during what I'm sure is a very busy time for her as well. Dr. Lobo will be answering questions submitted by the childcare sector regarding operating during the COVID-19 pandemic. So thank you for joining us today. We really appreciate that. I'd also like to thank Sandy Plinsky and her support of her staff during this time for the sector. Keeping us up to date and current has been valuable for the community, and THRC continues to be responsive during these unprecedented times. Halton Region and collaborates with the community, Halton Region, and uses current research and resources to ensure up-to-date information is available. Please stay tuned for upcoming professional learning that will include a panel of the emergency childcare educators who will be sharing their experiences with the community, as well as a session to support programs with their human resources needs and questions. I'd also like to address, and I'm sure everyone has seen the provincial announcement by now regarding childcare and early on's opening in September. This is great news and exciting, and I'm sure tonight's information session will be very helpful as we plan for September. We look forward to the guidelines being released soon, and THRC will be ready to support the sector. I'd also like to do some housekeeping. A reminder that the session is being recorded and will be available on THRC's website at a later date. We have approximately 60 participants attending, and everyone has been muted upon arrival, so no one will be able to be speaking or be heard. Only Dr. Lobo and I will be on the screen, so you should only be able to see the two of us right now. As mentioned earlier, we've been collecting questions over the past couple weeks, as well as any provided by Halton Region as well through their centralized email. If you have any questions, please feel free to put them into the chat. However, they will not be answered this evening. So all questions will be compiled and will be provided at a later date to the participants, as well as available on the THRC website. So please feel free to do that, but we will not be addressing those tonight. So I'd like to thank you again, Dr. Lobo, for joining us, and let's get started. So,
hey, thank you for having me here.
You're welcome. So the first question is, can you provide detail of the appropriate use of PPEs in childcare? We're hoping to know specifics around screening, diapering, caring for a sick child, and moving around the center.
That's a good question, and I think I should probably start by defining what is PPE and how it is different from face coverings, because there's a lot of news in media now about face covering and masking in public. So PPE is personal protective equipment. It is used to protect oneself from getting an infection, and a full PPE can include a gown, gloves, mask, face shield, and depending upon the task a person is performing, you may either wear full PPE or some parts of the PPE. Face coverings, on the other hand, are non-medical masks. They are used to protect other people from your secretions, and it does not necessarily protect the person wearing the face covering. So full PPE is usually required when a person is taking care of someone who is a confirmed case of COVID-19 or suspected to have COVID-19. In a childcare center scenario, I can see using PPE when probably a staff member is taking care of a sick child and cannot maintain that 2-meter distance from the child. So if they have to console the child, have to be with the child till they can be picked up, and the child is having COVID-like symptoms, then it would be ideal for the person to wear a medical mask, wear a face shield, wear gloves and gown. Also, maybe a screener. We are recommending and we are encouraging most of the screening to happen either by phone or happen online or by using apps. But if it is needed that in-person screening needs to happen every morning, and the screener cannot maintain a 6 feet distance or a 2-meter distance, if the screener cannot be separated by a plexiglass, then in that scenario too, it might be appropriate for them to wear a medical mask, a face shield, and gloves. Diapering, cleaning up body fluids generally requires only gloves and does not require full PPE. Face coverings on the other side. Currently, there is a bylaw in Halton region and in many other health units where face coverings are required when you're in an indoor public space. So childcare center is not a public space. Like people just can't walk in into a childcare center. So childcare center would be exempt from the bylaw. So technically, uh, each facility would then have to come up with policies on what the face coverings policy would be within their facility. That being said, though, today an announcement, like you said, Ministry of Education made an announcement today, which is just a news release to say that a childcare center will start at full capacity starting September 1st. And as part of that announcement, it was also announced that face coverings would be required for staff at all times. However, at this time, we do not know what they're suggesting this face covering should be like. We will have to wait and see what directions are going to come in the new guidance document.
Okay. Okay, perfect. So the next question is, what's the best thermometer to use and why?
So, generally speaking, we do not recommend temperature screening as part of a screening process because um, fever is not a consistent symptom that we have seen, especially in children and youth. And temperature screening has not been shown to be an effective strategy. However, if you have to check a child's temperature because the child is feeling feverish, then any thermometer is actually a good thermometer. But recognizing that we are now in COVID time and we are trying to put in as much IPAC measures as we can, infection prevention and control measures, it is preferable to use thermometers that have least contact, body contact, versus thermometers that require more body contact. So using infrared thermometers on the forehead would be the ones that would be most preferable to use, as it has the least amount of body contact. And also, there have been no adverse effects that have been reported using from the infrared from these thermometers or using these thermometers. They have been shown to be quite safe, and they are quite good.
Okay, okay, yeah, it was
I
specific
hope
to
that
the
answers
risks.
the questions.
Yeah, no, that's perfect. It was specific to
Yes.
the risk of having the temperature, so that's perfect. Um, okay, so the next one has a focus on sanitization. So can you go over the proper way to disinfect classrooms and outdoor play structures? The community has heard many different ways of disinfecting and are hoping to get some idea of what is the best practice to be doing that.
Um, so the main mode of transmission of COVID-19 is person-to-person direct contact. But there is a possibility that infection can be transmitted through fomites. And when we say fomites, we talk about any structures that people come in contact with. It could be doorknobs, it could be your electronic devices, it could be toys. So there is theoretical risk possible of possible infection from through fomite. Like you touch these things or touch these surfaces, and then you touch your mouth, hands, face, and then you can get infected through your mucous membranes. Um, Environmental cleaning and disinfection would be the best way to reduce this type of transmission. Any item, any equipment, a play structure should be preferably cleaned and disinfected between use of different cohorts. Um, Use disinfectants that have a DIN number, that is a drug identification number. It's an 8-digit number that has been provided by Health Canada that confirms that it has been approved for disinfection in Canada. The disinfectant must be used according to manufacturer instructions on the product. Um, the Health Canada has put out a list of products that can be used for disinfection, including Lysol products that are approved for disinfection. A list of these products is also available on our website. If you check halton.ca/COVID-19,
Okay.
we have resources that are specific for reopening, and under that we have resources specific for childcare centers. So a list of these disinfectants can also, a link to the Health Canada document can also be found there.
Okay.
um, Items that cannot be disinfected, such as books, paper, cardboard puzzles, these should be removed ideally, or they should be left untouched between use for at least, they say 7 days, but at least 72 hours would be preferable.
Okay.
Items that cannot be submerged into or immersed in a disinfectant solution, you would have to first clean them with soap and water if they are visibly soiled. You would have to dry them, wipe them with a clean cloth, and then use the approved disinfectant and use it according to the manufacturer instructions on the appropriate time that needs to be left on it. If does it require another rinse after the using the disinfectant, that instructions would be on the product. Ideally, you need to disinfect products between cohort use. Within a cohort, not so much as frequently. However, cots, cribs, and linens will have to be disinfected every day.
Okay. So that answers a bit about the next question. I think you've touched a bit on that one as well. So how do we manage children's personal items? So I know you talked about some of those soft toys and things that are harder to clean. So they're referencing blankets, stuffed animals, etc. So I think there's some clarity here where they're looking at, does that need to be cleaned every day, or can it be cleaned at once the child's gone for the week? Can it leave the center? Things like that, I think, are some of what folks are looking for.
Ideally, we would say not to encourage the use of these toys, the plush toys or the blankets that cannot be disinfected.
Okay.
If they have to be bought in, then it would be ideal that they are dedicated to one person use, and there is a dedicated place where the child can store this their items that they are using. um, so those dedicated items, if it is only one child using it, then it does not require as frequent disinfection. If, however, the toy or the item is being used by multiple kids, then it would need more frequent disinfection. That being said, within a cohort, like within a classroom, I think what the new guidance is going to be, they're going to consider one classroom as one cohort. We do not know what that number is going to look like. Currently, it looks like 15. That number might look like 20. We do not know, but we are encouraging that within a cohort, some of the IPAC measures can be relaxed. That is, physical distancing, disinfection may not be as stringent, but however, anything that is shared between cohorts needs to be thoroughly cleaned and disinfected.
Okay. Okay, perfect. Um, so the next one is looking at a bit of the physical distancing piece. So what is the best practice around social distancing in the classroom, particularly with young preschoolers or infants?
So we are talking about very young children here, and I think, I mean, it is good to speak to them about physical distancing. It's good to teach them about the role it plays in infection prevention using age appropriate language around it. But it is also not practical for us to enforce physical distancing in such a young age group. And we also have to realize that socializing, mixing with people is central to their development emotionally and socially. So that is why in this age group, cohorting and maintaining cohorts becomes much more important. So the idea behind cohorting is that you are minimizing the risk of exposure to other people. So what we are suggesting is that within your cohort, whatever the cohort size may look like, some of these IPAC measures can be more relaxed. We do encourage hand hygiene. We do encourage appropriate screening every morning, so every child be screened so that someone sick does not come in. But within that cohort, we are suggesting that you try and maintain physical distancing to the extent possible, like by placing chairs at 2 meters apart. There is suggestions that it might change to 1 meter, but utilizing different areas within the room for activities, having activities that do not require a lot of touching and hugging. But at the same time, we are saying some kind of uh, relaxation around physical distancing within a cohort is acceptable. But mixing between cohorts should be avoided as much as possible. And if there is mixing between cohorts, then the IPAC measures need to be a bit more stringent. The physical distancing, the plexiglass barriers would be more important when you're mixing between cohorts.
Okay. Okay. So you touched a bit on the next question in regards to how realistic is it, and if it's not, what steps should be taken? So I think you touched a bit about on that with the hand hygiene and just taking extra
Yes.
precautions.
Yes, and I think I do want to emphasize like physical distancing is not like thou must do it 2 meters at all times. It is, we're saying to the extent possible, optimize physical distancing within the classroom, optimize it within an indoor space, realizing that we are with very young kids. So screening them is more important, hand hygiene is more important, but within a cohort, some of the IPAC measures can be a little more relaxed.
Okay. Okay, perfect. Um, So the next few questions look at screening and exclusions. So we continue to hear many questions in the field around screening and exclusion, sorry. Can you help us determine when a child should be excluded and what are the symptoms that would make us concerned? So this had some background questions around runny noses, and there are children that would have allergies and things like that. So um, how would they be able to distinguish the difference, and what are some of the guidelines around that?
Yeah. This is a tough question to answer, but and I'll answer. Hopefully, I can help people understand the idea behind screening. So, when we say screening, we're trying to understand, is this possibly COVID? Right now, the symptoms of COVID are so vague that without actual clinical assessment or without a test, there is no way we can say if this is COVID or if this is any other respiratory infection, because the symptoms are quite similar to any other respiratory infection. That being said, the ministry has put out a reference document for symptoms, and we are required to use that reference document when we are screening for COVID like symptoms. We have requested the ministry to revise this the reference document for symptoms to see if they can be narrowed down for the age group, the children age group, but that is still being looked at. In the meantime, we do have to look at the typical and atypical symptoms when we are screening. If someone is showing any of these symptoms, then the most ideal step would be to have them medically assessed, because a physician can assess the child. See, for example, if a child has sore throat, it could be due to many other conditions. A physician can look at a child, can look into the child's mouth, probably see tonsillitis, test them for strep throat, have a diagnosis from strep throat, may not require the child to go for COVID testing because there is a clear explanation for the sore throat.
Yeah.
Sometimes the physician might say, no, this child probably needs COVID 19 testing, and then may refer the child for COVID 19 testing. That being said, staff members, parents know their child the best. Sometimes there might be a genuine reason for a child to have a symptom. For example, a child may have an excessive bout of crying and then vomited after the crying. Or the child might have been playing in the sun for a long time, came in and complained of an headache. So
Right.
when there is a genuine reason for a symptom, we would say maybe then this child may not have to be excluded if the child didn't have any other symptoms in the next 24 hours. Sometimes the child may already have a pre-diagnosed condition, like they might have allergies, like you said, they might have nasal drip, ongoing nasal drip, they might have bowel issues, which diarrhea is part of their normal symptomatology. So in those circumstances too, if the staff members, if the center knows about it, if parents are aware about it, then the child may not have to be excluded as well. But the reality is that if a child is having symptoms that are COVID like without a physical assessment, without a test, there is no way to say that this is COVID or not COVID. So currently, if a child screens positive that has symptoms, then the next best thing would be to ask them to get a medical assessment.
Okay.
And then, depending on what the physician would say, the child can return or get tested.
Okay. Um, so, so if the child has, if the parents and the staff are aware of any kind of symptoms that they would have typically had prior to, it's okay. I know some of the questions are if they say yes to one of the screening questions, knowing that it's part of something else, can they say no on that sheet, Dr. Lobo, or do they have to say yes to it?
They would have to say yes to it. I
They
think,
would.
yeah, they would have to say yes to it. It would have to be a fail screen, but then there would have to be some kind of documentation to say that this is part of children, this is a part of this
Okay.
child's normal medical history, or has been assessed by physician in the past for a similar symptom,
Okay.
and it is part of known child's known medical history. So, like I said, it is very hard for someone like us who does not know the child's history to make that decision. It would be like I would say, childcare center staff would be the best people to know how a child reacts when they have a certain symptom. Does this child appear their usual self?
Right.
Or does this child appear sick to you? This is not his usual symptom or her usual symptom. This does not appear right. So I think that is when the staff would have to make that decision. Um, but yes, just a sniffle, just a sneeze, just one symptom may not require them to be excluded if there is an explanation for that symptom.
Okay.
Um, but but like I said, I would like to repeat, the reality is though COVID-19 symptoms mimic so many other respiratory symptoms. Without an actual test, there is no way we can say that this is COVID or this is not COVID.
Right. Okay. Okay. Thank you. Um, so the next question is looking at the role of public health. So what is the role of public health once the child or staff has been sent home?
So, and thank you for this question. I think this is somewhere we need to provide some more clarity. Initially, when we had the emergency childcare centers open, and when it was new, COVID was very new for us, we were dealing with a new infection, we didn't know much about it. At that time, we did require that childcare centers call public health every time there was someone symptomatic in the center. But in the past few months, we have more experience with children in childcare centers. We also know a lot more about COVID than we did a few months ago. So currently, what we are suggesting is, and hopefully this will be reflected in the new guidance document that will be put forward by the ministry. What we are suggesting is that every time there is someone sick in the childcare center, every time someone fails a screen, there is no need for the childcare center or the childcare center operator to call public health. There is clear guidance around what needs to be done in such a situation. And my team is working on putting this document together, which we can share with all childcare operators. So if you do have someone sick in your center, a child or a staff member, you need to isolate them immediately. You need to put them in a separate room, have them picked up as soon as possible. If you have to be within 2 meters distance of the child, you need to wear PPE appropriately. The child needs to be medically assessed to determine is this COVID or not COVID. And the operator in the meantime will have to closely monitor other children in the facility. At this time, we are not closing down facilities. We are not doing a full contact in management for someone that is just symptomatic. We are waiting for test results because, like I said, it could be so many other respiratory infections. So there are clear guidelines, and we are hoping that once we share these guidelines with the operators, they have a clear step-by-step process to follow, and they do not have to call public health every time they have sent someone home because there have been symptoms. You clean the place, you disinfect the place the child has been, you closely monitor everybody else in that cohort. That being said, you can always call public health. You have any questions, you want to reach us, you have doubts about what needs to be done, call public health. There are no wrong or right answers. But currently, whatever we do as an assessment can actually be done by the childcare operator. Um, and there is technically no role when there is only someone symptomatic in a childcare center. No role for public health, I mean.
Okay, okay, that's great. So the next question is, what is the role if the child or staff have tested positive for COVID?
So yes, so this is definitely when you must call public health. If we get notified of every positive test result, but we also request that if you become aware that if a parent calls you and tells my child has tested positive, if a staff member tells you about the test result, please inform us immediately.
Okay.
This is where public health staff will work with the child care center to do a risk assessment. Currently, the guidance is that if there is one confirmed case in a child and the child has been at the child care center during their period of communicability, then we need to declare an outbreak in the facility. So declaring an outbreak just ensures that we are extra vigilant. We are doing more environmental cleaning and disinfection than we would normally do. We are being a little more careful about all IPAC measures. Also, we would help you with doing case and contact management. So um, public health would determine what is the self-isolation requirement for the case, when would the case be able to come back. We would also help you identify who would the close contacts of this child or the staff member or this positive case be. We are hoping that it will just be the one cohort that we're dealing with, but during our risk assessment, if we do find that there has been mixing of cohorts, the child has been or the staff member has been between other cohorts, then we will have to look at that as well. And then public health would work with childcare center staff members to come up with communication for the cases, for the contacts, for other staff members, for families within the center. So we will work with you to see what kind of communication needs to go out, what that communication needs to look like, um, what measures we are going to put, additional measures we will be putting in place for the next 14 days, and when can the close contacts can come back, when contacts need to be tested. So those are some kinds of a guidance that public health will provide when there is a confirmed case of COVID-19 in a childcare center.
Okay, so folks are wondering around the statistics around children having COVID in childcare. So is there a number or any sort of statistic you can share?
Um, there is no statistic as such, but if you look at it, like across the globe, less than 10% infection have been in age group less than 19.
Okay.
Even in Canada, our, if you look at the case counts, around 7 to 8% of case counts are 7 to 8% of cases are in age group 0 to 19. And even in that, 0 to 5 forms a very, very small number of our age group. There is enough data to suggest that little children or a younger age group is less susceptible to COVID-19 infection and potentially less likely to transmit the virus to others. Some of the studies that have focused on studying of cluster of cases where children have also been involved, when they have studied these clusters in more detail, what they found out is that the transmission happened more from adults to the child and not vice versa. It was more likely that the adult in the home got it somewhere in the community and was the index case and not a child. While there are no studies that are specific for daycare settings and school settings, when we look at jurisdictions outside of Ontario and outside of Canada that have had schools open up, they haven't seen any huge increase in the number of cases because schools opened up. They did not see big clusters of cases in schools. Um, and several countries have opened their schools, demonstrating that it is quite safe to do it. So currently, from what we know, we do not think that children are major transmitters of the disease. So we are hoping that once we open up schools, we open up childcare fully, that this would be true. But we will know once we know. I mean, schools have been closed now for a long time. Childcare centers have also just opened up with limited capacity. So I think we will have to closely watch and see how this will affect the case counts.
Okay. Okay, perfect. Thank you. So the next question is looking at visitors and what some of the guidelines are around having a visitor. So we understand that during this pandemic, we must not have any visitors into the center. This includes children's parents and any new prospective parents, so parents wanting a visit or tour. Can you explain why?
So I think your question needs to be non-essential visitors,
Okay,
because visitors could be essential and not non-essential. And I
right.
think we why. So I think all these IPAC measures we are putting is basically to create a safe environment within the childcare center or within the facility. I don't think we will ever be able to provide a risk-free environment. Our aim is to provide an environment that has a balance of that is safe. And try to balance it with what can we avoid, what can we do to prevent that infection from coming into the facility.
Right.
So visitors can carry infection into the facility. It is a possibility. And hence, if it can be avoided, we are asking that it be avoided. So to the extent possible, we are recommending that any conferences, any communications you need to have with parents, uh, to have it via remotely, like by telephone, by Zoom, how we are doing our virtual visit. If parents want to look at a center, is it possible to do it virtually? If it is possible, then yes, please try and do that. If it is absolutely necessary that you want to bring a non-essential visitor into a center, then I would say it is best to schedule these at the end of the day once
Okay.
children have left the facility. But keeping in mind that if the visitor is coming, you need to screen them, mask them, follow all IPAC measures um, if you have someone visiting the facility.
Okay. So that actually answers the next question, Dr. Lobo, too. Are there any exceptions to the policy? So making sure you've put the proper protocols into place, follow procedures, if you need to have someone come in,
Yeah.
that
So
would be
I
that.
think that's where you need to be to differentiate between essential visitors and non-essential visitors. So
Okay.
essential visitors probably would be exempt from such a policy. Like, for example, if you have ministry staff, you have public health inspectors who need to come in to inspect this place, you might want to screen them, but you will have to allow them to come in.
Okay.
But these are all people that are employees. So, and all employees are now screening their employees. Like, for example, public health, like Halton Region Public Health, we screen all our employees every day.
Mhm.
So if they are working, that means they have passed the screening for that day. Whereas there are some essential visitors such as ambulance or paramedics and fire,
Right.
you might have to allow them in depending on the situation.
Right. Okay. Okay.
So,
Perfect.
so, so have policies for non-essential visitors and essential visitors.
Okay. Okay. That helps clear that one. And I think you're right. Virtually is going to be the way to go. We're connecting more remotely for sure. So
Yes.
Um, so the next question is around staffing. So we have heard there is a lot of fear from staff who will be returning into the reopening of their center. What is the risk for staff, and how much of this is mitigated by the guidelines and policies? So that's a wholesome question.
Yes, and I think I've answered bits and parts of this question.
Yeah.
So some of the things what we do know is that children form a very minute group of our case counts currently. They have not been shown to be major transmitters of the infection across the globe. Um, the IPAC measures that we put in place are to provide a safe environment both for the child and for the staff in the childcare center. It's never going to be possible to provide a risk-free environment, but with the IPAC measures that we are recommending, we are trying to reduce that risk to as minimum as possible. Currently also, the community transmission in Halton region is low. Like, our case counts currently are in the single digit numbers. That might change come fall, but currently the risk of community transmission in Halton region is low. We also have to remember that majority of the infections are mild. Majority of people will recover from this infection within 3 to 5 days without any complications. So we need to keep that in mind. It's a few people that are vulnerable, and those are people with some pre-medical conditions, people who are immunosuppressed, people who have cancer, people who have other medical conditions that are not well controlled, such as asthma, diabetes. So these, if a staff member has any pre-medical conditions, it would be best that they speak with their healthcare provider to understand their vulnerability for complications from COVID-19 infection. Is it possible then for them to work with PPE? That is something they need to consider. Or would they have to speak with their employer for modified duties? That would be something they have to consider. But this would be for staff members that have a medical condition that's not controlled and that is known to be more prone for complications from COVID-19. So otherwise, for someone who is otherwise well, majority of the times the infection is mild, and majority of the times people recover without complications.
Okay. Okay. That's perfect. Um, okay, so the next question is looking at the field really wants to know how and when to call public health. So you answered that a little bit about
Yeah.
just calling. Is there a dedicated staff? So they're looking at, is there like a specific number to call? Is there a right call or a wrong call? So who do they call?
So yeah, let me reiterate. Currently, childcare centers are calling us every time they have someone symptomatic. We are
Right.
hoping once we provide them guidance around what to do when they have someone symptomatic, they would not have to call us. We would also provide this guidance on our website under childcare center resources, so that information will be available there. You would have to call us when you have a case, a
Yep.
confirmed case.
Yep.
You can call us, and there is no right or wrong questions. You can call us anytime you have questions. We do not have a dedicated number. You call 311. Um, and we do have dedicated staff though. So there would be some dedicated staff member that would call you back once we get that uh, information through when you call 311. Uh, but but these are unprecedented times. Our call volumes have been through the roof.
Right.
So we have tried our best to return calls within 24 hours. So if you have called us, we will return your call as soon as possible. And we do have dedicated people working on that have been deployed and working on COVID-19. So we have staff working, and they will call you back, but we are also trying to put as much information that is relevant to childcare centers on our website. So halton.ca/COVID-19. There is a section there that is specific for reopening guidance, and under that there is specific documents that are for childcare centers. We are hoping that a lot of information that you are looking for will be available through that venue for you.
Okay, okay. Um, so the next question is looking at, it aligns with the one before, but when and how will public health advise us if we need to shut down a room or a center? So you did talk a little bit about the whole, if there's been a call. Is there
Yes.
anything to add to that one?
So I think the biggest concern that childcare centers have had is, will we be asked to close down if somebody is symptomatic? So I think we have come to a point where we are saying someone is symptomatic, needs to be really assessed. We need to be sure that this is COVID-19. Currently, the transmission in the community is quite low. So we need to be sure that this is COVID-19. So if they have tested and if they come back positive, then there is, and we will do a risk assessment. And based on that risk assessment, I think that will help us determine, do we just closely monitor people? Do we just close one cohort, one room, or we may have to close the whole center? So that will be a decision we will work in collaboration with the childcare center staff. Um, and any communication that needs to happen to cases, to contacts, to family will be drafted in collaboration with the childcare center staff. And that communication will also include communication around self-isolation requirements, testing requirements, what to look for, how to monitor, and when it will be safe to open up, or when it will be safe to come back to school, or to the care,
To the
or to the
center.
childcare center.
Okay, okay. Um, You've answered this one a little bit too, but this is actually the last question. So are there resources we should be looking at to eliminate any unnecessary calls? So I know you've touched base on the website and the
Yes.
guidelines.
Yeah.
Um,
Yeah, I think currently the best one is to look at the guidance that is put out by the Ministry of Education. There are some fact sheets and some guidance document that Public Health has also created for childcare centers that are also available on our website. We are specifically working on, I think most of our calls in the past few weeks we have seen has been when someone has failed a screen or when someone has been symptomatic. So we are hoping to create a document around guidance specifically for that, so that it will help answer a lot of your questions and you do not have to call us. So that will also go on our website. Helpful links would also go on the website. Like, I think there is a link for the Health Canada disinfection document as well. So I would say check the website. If you still have questions, call us.
okay, okay, perfect. So that was it as far as questions for us. So,
Hi, Mel.
hi.
Dr. Lobo. Um,
Hi, Rebecca.
sorry to pop on, but what a great night, great information. Dr. Lobo, you've been really helpful in making people feel calm. The reason why I've popped on, Mel, before you get to the final is that we have a few questions that have come in, and just a few.
Yep.
And since we're a bit early, I wondered, Dr. Lobo, if you would maybe have a look at them and see if we could
Oh,
answer.
yeah.
So we
If I am
debated,
able to answer it, I will answer them.
we debated in the background whether I should pop on, and I wish I had washed my hair, but we felt that if we had the time, and it would really be great for you to do that. But again, thank you.
No
Mel, if you
worries.
can get on to your you can get onto your chat, you could see them and maybe ask what they are, or I can just hand them over to you now, or I can ask them, whichever you want to do.
Let me see if they're on here.
Okay, if you can. So why don't I start? Dr. Lobo, the one that came in fairly, well, halfway through, and I think it was when you were talking about cohorts and the benefit of cohorts in sort of containing some of the infection, or the potential of infection. The question came in, why are they now mandating that childcare workers have to wear masks if we were okay with no mask and with cohorts before? So I guess this is, somebody has read this in the press today, obviously,
Yes.
and just wondered if you might be able to give a bit of an answer on that.
So I think they have to recognize that some are policy decisions and some are public health guidance recommendations. So within a cohort, I would say if you have done the appropriate screening, the appropriate hand hygiene, appropriate disinfection, then probably using a mask, I would have said, would have been a personal choice at that time, because you're within your cohort, you are within the space that where we are saying is okay to be. Some of the IPAC measures can be relaxed. But sometimes policy decisions come from the government, and I am unable to say what goes into their decision making. So I may not be able to comment on
Right.
why they made such a decision.
Right, and fair enough. So I think that we'll know more about that as the time goes on. Another one, and I think this is fairly straightforward. Well, I know is not one that you'll have to worry about balancing whether you should answer or not. Could you go over what happens if a child is symptomatic, and what to do with the sibling? Do they go home if they have the symptoms, or do they go home if they don't have the symptoms, I guess, the sibling? So wondering how to manage that.
So yes, the sibling would also not be allowed to come to daycare the next day. Whether they have to go the same time, not necessarily, but parents might prefer to pick them up at the same time so they don't have to come back again for the sibling. So what would happen is that if the child is sick while at the center, they definitely have to be self-isolated and sent home. Next day, though, their sibling would fail the test because they would have been in contact with someone who has been sick, or a household member who has been sick. So until that household member, which would be the sibling, has been tested and or has been cleared to say that it is not COVID, that sibling would also not be able to come back. So whether they have to be sent home the same day, not necessarily, but parents might prefer to pick them up together, but they will not be able to come back the next day because they would fail the screen.
Right.
So because they would have been in a close household member who is sick with COVID-like symptoms.
Right. Okay, so that makes sense. A couple others have come in, and we'll make sure we don't have a floodgate going here. We only have a couple more, and if more come in, we will have to cut it off at a certain time. But right now, I think we're okay. And this one, Dr. Lobo, I think might be something, again, that's coming out in some of the additional guidelines from the province, but I'll throw it your way anyway to see if there's anything that you could say at this time. For September, would the same cohort, no mixing rules apply? now we couldn't have one open room and one, oh, now we couldn't have one open room and one closed room. We have to have an opening and a closing staff for each room, which is a huge challenge. I guess what the main point of this question is, do we know if the same kind of rules are going to apply with cohorting?
I would say I think so. We just don't know what that size of the cohort might look
Right.
like. It
Yeah.
is my understanding they will say one class is one cohort. Right now, it's capped at 15. They may cap it at 20. I don't know what they're going to cap that number as, but they've also said in their news release that they will be strengthening the IPAC measures. So I'm thinking they will be asking us to do a lot more of cleaning, a lot more of physical distancing, a lot more of screening, a lot. So they have said they're going to increase all other IPAC measures.
Yeah.
So the understanding is that one class will probably be one cohort, and mixing between cohorts uh, will be should be avoided, but we will see what else they will come up with when the guidance document comes out.
Yeah, and thank you. I mean, I think that's fair enough assumption that the cohorting is going to stay. It's just the size of
Yeah,
probably the
it's
size.
just the science behind it, right? So the whole
Right.
idea is that you're trying to minimize the people exposed if someone was to become symptomatic.
Yeah.
And if someone was to become a case of COVID. So then you're minimizing that exposure, because if that person would be in multiple cohorts, considering the age of the children that we are talking about, physical distancing is not something that they can do. Masking is not something that they can do. So
Right.
cohorting would be the best strategy in my mind to
Yeah.
reduce that spread of transmission.
Yeah. So those are likely here to stay. And I think the last question that has come in is similar and certainly relates to what you're talking about. And it's asking, can we combine cohorts at the end of the day when we have fewer children in the school, like for our before and after school?
Before
And
and
I think, yeah,
So we have asked the ministry the same question, because that would impact resources a lot. If you're talking from a purely public health perspective, I would say no, but we have to balance it with resources. And we are told that there is specific guidance going to come out just for before and after school programs. So they might, we do not know what that is going to look like, but there is specific guidance that will be coming for before and after school, because this will be applicable to schools reopening as well, because how they are going to manage their before and after school program if they have to maintain cohorting throughout the day. So if you're asking my opinion, I would say try and avoid mixing cohorts to the extent possible.
okay. And you know what? There's actually one other question that snuck in or I didn't see, and it is asking, what is the best solution for suitable for outdoor play structures? I don't know that you, I mean, you
I
did
wouldn't
talk about
know.
solutions.
Yeah. I mean, that would depend on the type of material you're talking about. Is it plastic? Is it wood? Is it porous? And I think Health Canada has put out as much as guidance as they can about disinfecting play structures and disinfecting items. But you would have to look at the product. Is it suitable for the item that you're talking about? Does it have a DIN number, which is very important, so that you know that it has been approved in Canada for disinfection. Um, but it would depend on the product you're talking about, and can it be disinfected, and how best it can be disinfected.
Right. Okay. Thank you. Melanie, I'm going to hand it over to you.
Okay.
And I will back out from my surprise visit.
No, that's great. Thank you.
Thank you, you too.
Okay.
Okay. So we've got all the questions asked. That's perfect. Thanks, Rebecca, for coming in. Not too bad. That wasn't too bad. That was not too many questions. So I just want to wrap up. I want to thank you again, Dr. Lobo, for joining us this evening. We really appreciate your time and time well spent. I'm sure the programs have been itching to get some information, and I know the guidelines will be coming out. It'll be supporting people with more information, and we're all sitting on the edge of our seat waiting for that, knowing that that's coming as soon as possible. So we do appreciate you coming and shedding some light on that for us. It's been really helpful. Part of what we'll be doing next, so for anyone participating this evening, you will be getting a short survey following the session. Please take the time to complete the survey. It's important in getting your feedback to help guide what we do next for future sessions and information. I also want to thank our admin team who took the time out of their busy schedules as well to support some of the navigation of some of the virtual work that we've been doing. So thanks very much for your support, and as well Halton Region for their collaboration and connecting us with yourself, Dr. Lobo, as well as the providing us with some questions and answers as well. Again, as mentioned earlier, the question and answers will be available on the website. THRC has a COVID page that you can click on, visit that page. It will have all the video recording of the session, as well as any questions and things that people will be looking for as well. And we look forward to supporting you in the near future. So thanks everyone, and have a great night.
Thank you. Thanks for having me. Nice
Thank
to
you.
meet everyone virtually.
Yes, thank you.
Bye.
Bye.